This is insane. Don't you jump out. What? No, 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 no.
Next,
See how she blots like a water balloon?
a rescued Easter Bunny's belly worries Dr. K.
Can't wait to get in that belly.
A guinea pig love connection may have unexpected results.
What did that boy do to you, huh?
I'm looking for his bladder, and it's empty, empty, empty.
And a special needs goat won't give up the goods.
I got the urine. Yay! We're happy.
Morning.
Hi.
Dexter, a 3-year-old goat, has blood in his urine following a recent emergency surgery.
I brought Dexter. He's our micro-pygmy goat. He had urethral obstruction the other night, and we took him to the emergency clinic. So he had a little procedure, and we've just had a little bit of urination with blood. He still seems a little lethargic, and just want to make sure he's feeling better.
Look at his bow tie.
Can I weigh you? I don't know how I'm getting you
Love his
out of
bow
here.
tie.
Do you want to lift his front? He's brain dead.
He's brain dead?
He had really bad pneumonia when he was little.
He got pneumonia when he was about a month old. With the pneumonia, it really slowed his mental development down. So he pretty much just relies on people to guide him in the right direction.
Oh, he's so cute.
He doesn't like to really walk, and we kind of have to take him everywhere since he doesn't eat on his own, so we have to formulate his own diet. He's definitely our baby. You know, we have to feed him 3 times a day, and it takes about an hour.
This is the most paternal thing I've ever done in my entire life. I'm not gonna lie to you.
Bye, Dexter. See you later.
When we go to dinner, he comes with us and sits in a stroller and pretty much goes everywhere. It's full time, all the time.
I have Dexter, a 3-year-old male goat. He is consistently dripping blood after he urinates.
Dexter wound up at an emergency room in the middle of the night at a pet emergency center. What they did there is that there's a little skin tag on the end of their penis that kind of covers it. They actually take that off to help make sediment and stones pass a little easier. But at this point in time, Dexter's circling back to me because now he has blood in his urine. Hey.
Hello.
Oh, good to see ya. So they said he's lethargic.
He definitely doesn't look like he's feeling well.
Oh, buddy.
Just kind of staring at the ground. It's like this morning when he first went out, you know, he peed and then he laid down, which he doesn't do.
Right.
'Cause
And
usually-
was there blood this morning?
Not as much.
What could be causing blood in Dexter's urine is either infection, heavy sediment, or even a bladder stone.
You're all right.
Whatever's going on with Dexter, we have to fix it. But when he does pee, he's able to get a good stream.
There's a good stream, and then he'll drip, you know, for about 5 minutes. You know, just
Really?
sporadically.
All right, let's get some blood work on him, and then I'm gonna use the ultrasound to get a sample from his bladder directly so that we can culture it and get an accurate urinalysis.
Behave yourself, handsome.
Oh, he is so good. I don't know who's cuter, Dexter or his dad, who spends hours daily taking care of this fantastic special needs goat. It's like taking care of a baby that never grows up. Well, I haven't pushed a stroller in quite a while. At one point in time, I had 7 different strollers in my garage. Because you have to have the single jogger, the double jogger, the quick umbrella one, the one you use in the mall, the one you use in the park. It was ridiculous.
Yeah, it sounds like it.
Don't you jump out. What? No, 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 no.
Thank you.
No problem. Don't jump out.
Very anxious. I want to make sure that he's feeling better.
He's the cutest little thing, isn't he? I'm very committed to finding out what's ever wrong with Dexter. I want him healthier, I want him more comfortable, and I don't want to see blood in his urine. You're all right. I know you don't feel good today.
He's
Are
cute.
you goat burping? You're a good boy. He's the cutest little thing ever, isn't he?
Marley, a female 2-year-old leopard gecko, is losing weight at an alarming rate.
So I'm bringing in Marley. She's a leopard gecko. She's showing some weight loss in her tail, and overall weight has dropped. So I just brought her in to figure out what the problem is with her. She was one of the first female leopard geckos that I've had. I've had leopard geckos growing up since I was a little kid, so she's definitely one of the nicer geckos that I've had, so definitely got to get her feeling right. Hi, how are you?
I'm
Nice
good,
to
I'm
meet
Dr.
you.
Thielen.
Tim.
Nice to meet you. Hi, baby girl. When I hear a leopard gecko has suddenly lost weight and is not quite acting right, there's quite a few things that could be going on. It could be something like organ damage, infection, parasites, even cancer. I need to do a thorough physical exam to figure out what's going on.
Her tail was probably
It's okay, it's okay.
at least twice the size of what it is.
She's like really thin, I agree with you.
It's thin and then she buffs
But
out.
she is really distended. I feel like I can feel something here that's really long and on here, this side too. I wonder if we have some eggs. These eggs, or whatever I'm feeling inside Marley's abdomen, are ginormous. They're almost the size of her head.
I don't breed her, so I'm thinking she's packing dud eggs.
Yes, they wouldn't be viable, but... Oh, look, you can see it.
Is it right there?
Do you see?
Yeah, right, that one right there.
Yeah. I'm 99% positive that what I'm feeling in Marley's abdomen are eggs. Really big eggs. If we were to leave the eggs inside Marley, I'm really worried that she would continue to decline and we could even lose her. Because these eggs are so big and so abnormal, they're never gonna lay. I would say this is surgical. She just needs an
She
operation.
needs to get the eggs out.
Yeah.
I guess main concern is just, I guess, how she's gonna handle the surgery and the anesthesia.
I am hopeful. She looks bright. She's very active. I just think as soon as she gets these out, she's gonna be feeling a hell of a lot better. And if this is my own gecko, I'd be taking all these risks.
Alriady.
Okay, great meeting you.
Thank
Sorry
you so
about the
much.
circumstances.
Hey, things happen. I definitely had a feeling it could have been an egg issue, and doctor says that's, seems what it is. So hopefully, the surgery works. She does all right, with the surgery and anesthesia. She gets the eggs out and starts feeling a lot better.
If she moves around a little, it's okay. We're doing an egg check.
Stay.
I'm taking x-rays on Marley to be able to count how many eggs she has to get a better idea of what kind of surgery we're gonna get ourselves into.
She tried to bite you?
Yes.
She's not being very nice. Your x-ray is over, Dr. Thielen.
Thank you.
In the front of the clinic, Lucy, an adorable rescued Easter bunny, has a bump on her chin and isn't feeling well.
I brought in Lucy. She's my little bunny. She has a growth underneath her chin. Lucy showed up at my door about 3 years ago and actually took my dog outside to use the bathroom. I looked under the car and there was a rabbit trying to climb up because she was scared. She hopped over to me and just let me pet her. So I called the Broward Humane Society and they said that usually around Easter time, people get bunny rabbits for their kids. And then after they start getting bigger and Easter's over, then they think they're setting them free, but really they're putting them out in the wild to be food for another animal. So I kept her. She seems to be happy.
Good morning, how are you?
morning.
Where is my patient?
She's right here.
There you
How
are.
doing?
Hey, Lucy, what's going on, honey?
She has a little growth under her chin.
Hi, beautiful. Weren't you lovely? You're getting ready to chew those wires, weren't you? So she is 3. She's not spayed, right?
No.
Okay. All right, princess, let's see what's going on. Is she still eating well?
Yeah, and drinking well as well.
Great. All right, super. So this mass feels like it's just in the skin here.
Okay.
There's a little abscess at the base of it. I don't like how this is dark like this. It's okay, honey. What I'm also feeling here is that her jaw is really bumpy. I'm worried that there is a tooth root abscess right here because you can feel this lump on the bone here.
Yeah, you can.
Yeah, so there's a big bump there. So we're gonna need to take some x-rays and see what's going on with the tooth roots there.
Is she overweight? She eats a lot.
Yeah, not too bad.
Not too bad.
You definitely need to get spayed. Lucy came in today because the owner found a bump on the left side of her face. But when I'm doing her physical exam, her belly feels like it's full of a lot of fluid. I don't want to worry Josh, but I want to take Lucy in the back and investigate a little further what's going on with this lump on her jaw, and there's something really strange going on in her belly. I will kidnap that beautiful bunny from you for a few minutes. Hi, if you can have a seat in the waiting room, okay?
Okay,
Thanks.
thank
Yep. Hey, can one of y'all set up rads for me? Remember that bunny that we had that had the uterus full of urine?
Yes.
She almost feels like that. Yeah, but see how she blots like a water balloon?
Yeah, yeah.
It ain't right. It ain't right. Remember that bunny that we had that had the uterus full of urine?
Yes.
She almost feels like that.
Lucy, the rabbit who came in for a bump on her chin, may also have a serious stomach problem.
See how she blots like a water balloon?
Yeah, yeah.
Lucy has a little Buddha belly, and her owner's actually been concerned that she's been becoming overweight. So the owner's right about her belly being too big, but I'm concerned that this isn't just fat. I think there's something medically going on with this little girl. I thought you felt a little jiggly in the room.
Yeah.
When I was palpating her in the room, her belly felt very distended, but when they're a little bit tense in your arms, you can't necessarily always tell, but when we got her completely relaxed, it waves like a water balloon or a waterbed. It's most likely her uterus filled with urine. If Lucy does have urine up in her uterus, this can turn into a life-threatening problem. What happens is the urine can actually reflux up into the vagina and then into the uterus. Now, once it has already done that, the uterus just tends to start filling and filling and filling with urine, and the uterus doesn't have the same mechanism that the bladder does to help squeeze the urine out of the body. So the next thing I need to do is stick a needle in her uterus and pull out this fluid and see, is it really urine or is there something else going on here?
Oh.
Yeah.
Oh.
Yeah. Ooh. She's got just a belly full of this clear fluid. When I've seen this in the past, it's been associated with the uterus, and spaying the rabbit completely resolved the problem. And once I get a better look at what's going on in her belly, there's a pretty good chance we're gonna have to put spay on the list for what this little bunny needs done today. Thank goodness this bunny came in when she did. All right, come on out. I want to show you the x-rays there.
Okay.
All right? She's doing fine.
Okay.
I just want to be able to show you. Like, this would be a normal animal where you can see intestines and gas pattern and organs.
Oh, my
But
goodness.
everything here is obscured. Huge amount of fluid through the whole thing. I could be wrong, but it's most likely her uterus filled with fluid.
Okay. I was surprised because I thought she was gaining weight, and it turns out it was just the fluid buildup.
And so usually that's easily solvable by spaying them. So what's going on with Lucy is she's actually had urine from her bladder reflux back up through her cervix and into her uterus. This is a bad situation. This could lead to severe infection. So what I need to do today is spay her to completely remove her uterus and block that pathway. Now, what's bothering me more is her teeth, okay? See these dark pockets around the teeth here?
Yes.
That's what we worry about. This tooth in particular right here is loose, and we should pull it.
Okay.
All right? And as long as she's already gonna be under anesthesia for the spay, we can at least get that
That one out.
most problematic tooth out, okay?
She's a part of the family, so if anything's wrong with them, then you always want to make sure they're not in pain and they're getting taken care of.
Lucy will undergo not one, but 3 procedures. A spay, have her tooth pulled, and Dr. K will surgically remove the lump on Lucy's chin.
It's okay, honey.
Your x-ray is over, Dr. Thielen.
Marley the leopard gecko's x-rays are ready for Dr. T to review and get an egg count.
Taking a look at the x-rays, unfortunately, it's just one big blob of gecko. And so in order for me to be able to investigate things further, I need to do an ultrasound. Okay. Gel me.
Joe-me. Okay, sorry.
I need to get an accurate egg count, so if we have to go to surgery, we know how many eggs to remove. Huh. It's very fluidy. Do you see that?
Uh-huh. Why so enormous?
I don't know, but I can palpate these distinct structures. I see 2 eggs inside of Marley, both of which appear to be fluid-filled. This could be a complication because the eggs may not be developing normally, or they're dud eggs, and that actually may prevent her from laying them normally. I don't know why they're so big. I just know that this animal needs surgery, and that's definitely an egg. The reason why I want to get Marley's eggs out of her ASAP is because, first off, Marley's rapidly losing weight, really declining, not doing well. Second off, the eggs weren't even calcified. I couldn't even see them on the x-ray, which would indicate that she may have a metabolic issue underlying, which would further prevent her from ever laying these eggs naturally. Because these eggs are so big and so abnormal, they're never gonna lay. I would say this is surgical. She needs a surgery.
Dr. T will update Marley's owner and take the leopard gecko into surgery as soon as possible.
Yes, we are. Gotta call your dad and tell him. Here you go.
Dexter, the special needs goat, is dripping blood when he pees. Dr. K needs a clean urine sample to figure out why.
Up we go. With Dexter, I really need to get a nice clean urine sample because he had some sludge that blocked him up. He had this process at the tip of his penis cut off on emergency the other night.
I know. Let me massage your temples. You're stressed.
So we're concerned about a urinary tract infection. So we're trying to get a urine sample because I want to know exactly what's really going on in the urine. All right, bud, where's your bladder?
An ultrasound will help locate Dexter's bladder. If it's full, Dr. K will use a needle to pull urine directly from the source.
What are you constantly chewing there?
He does that chewing thing. It's part of his neurologic.
Physiologic?
He doesn't eat like a normal goat because of his neurologic condition. He eats mostly just a gruel. He doesn't eat the high-fiber hay and browse like a goat should. The diet does influence his urine. Oh, there we go. Oh, you are just that gas. Can we turn off the room light, please? Just. Yeah, that's his bladder. I'm looking for his bladder, but this is it right here, and it's empty, empty, empty. An empty bladder. Well, you are empty. That's no bueno. I want to know what's growing in the bladder. But his bladder's very empty right now, so we gotta wait.
Look at that. Look, it's from here to there, the egg.
Oh! I've never actually seen the proper egg.
This is a weird egg.
Since Marley is unable to lay the eggs naturally, her owner agrees to move forward with surgery.
This animal is really, really small. And so there is a lot of risk with blood loss as far as the surgery goes. I have to be really, really careful. She has eggs that are like, I didn't even know they could grow to be this big in a leopard gecko. So we'll see how it goes. Bottom line is I don't want to put her at too much risk. This animal might be too small, this might just be too much, yeah. So we're about to find out. So I'm just gonna very gently try to get this thing out. This is insane. I've never seen a leopard gecko egg that big before in my life.
That's the size of her head.
Yeesh.
This is insane. Like, to me, this just, I can't imagine them normally being this big. Okay, there's the other one. By taking out Marley's huge eggs in her abdomen, she's gonna feel a lot better and is going to be able to eat normally and hopefully gain back some of that weight that she lost. I'm not quite sure why Marley didn't lay these eggs naturally, but we're gonna go ahead and spay her to make sure that this issue never happens again. Okay, so now we're gonna try to close her up.
Wow, she looks completely different.
She looks like a different gecko.
Yeah.
Once awake, Marley will spend the day recovering in the warm room until she's ready to head home.
Hey, sweetie.
I'll leave it out in case you change your mind.
Goat in the whole wide world. Do you want to help me with them? Flip them up?
Sure.
So it's round 2. I'm going to try again to get a clean sample of urine from Dexter's bladder. All right, Bubby. He's a simple lad. Oop, I know, baby. When I do the urinalysis, we find out what the pH is, are there bacteria, is there blood, what's growing. We just get a lot of information from the urinalysis. See, that's just all gas when you can't get a good image. Why are you so gassy? Because you're a goat. It's very challenging to use ultrasound on goats because being an herbivore, they process their food by fermentation. This creates a lot of gas. The ultrasound waves cannot go through gas. Ultrasounding an herbivore, it's a good time.
It's the hardest.
This is turning out to be harder than it should be. All I need to do is use the ultrasound to find the bladder, stick it with a needle, and get a clean sample of urine, but nothing's easy with a goat. And a good time was had by, oh wait, is that bladder? Hold on, wait. Oh, that looks promising. Ta-da! Past all these gassy intestines, I can see a nice full bladder. I'll be able to get my sample. Why don't we tip them over now that we can see where it is?
Here you go,
That looks like real gross urine.
Definitely bladder.
It's sludgy looking, isn't it?
Very sludgy.
You guys sludgy pee-pee, honey. Thank you.
Okay, there you go.
I got the urine. Yay! I'm gonna want to
That is
sediment on
gross.
that.
You're gonna want all the things on that,
All
I
the
suppose.
things. I got some pee, that's good, but what I don't like is that it does appear to have a very heavy amount of sediment in it. First thing I need to do is a full urinalysis on Dexter, look at the sediment under the microscope and see what kind of crystals are in it. And I also want to get this out for a culture, just to make sure that a bacterial infection isn't part of what's causing this trouble as well. Dexter, we have pee.
Oh my God, let's not be so active right now. You just had surgery.
I feel great. Those huge eggs are out of me.
That looks great, baby girl. Yes, it does. Marley, the little leopard gecko who had 2 giant eggs stuck inside of her, is recovering well from her surgery and will head home a lot smaller than when she came in.
She lost like 12 grams. Yeah, she was like
You
47.
recovered so quickly, Marley. We're so proud of you. It's great. Yay. Hi. There she is. She's a new woman.
What's up, little one?
Look how slender she is.
Feeling brand new?
I'm very, very happy how she did. I expect her to continue to gain weight and thrive at this point. Now that she has like space in her belly to be able to eat, I'm gonna put her on antibiotics for a couple weeks and some pain medication just for a couple days and some food until she gets a little bit bigger.
She got that knot out of her belly.
She's pumped. She loves her life.
She's doing great. I'm happy. Marley seems to be happy. So all is well.
Thanks
All
so
right,
much.
Thank you so much.
You're
Appreciate
welcome.
it.
Lucy the rabbit came in for the bump on her chin and will now undergo 3 medical procedures. Addressing the bump on her chin, an infected tooth, and a spay.
Can't wait to get in that belly.
I
See what's
know.
in that belly. I thought you felt a little jiggly in the room.
Yeah.
Lucy's owner came in because of the bump on her chin. I'm pretty suspicious that that's a tooth root abscess. I'm more concerned about all this fluid in her belly. So we have to address these major medical problems with this little bunny today. She's gonna be so skinny when we get that out.
Like a little deflated balloon.
Ready for bikini time, huh? There we go.
It looks like it still has a bunch of liquid in
She
there.
does.
Hopefully it's all contained within her lady parts, though.
Yeah, we'll find out in a minute. Boop. Oi.
Oh, my.
Oh, well, you know, holy
That's all of
mother
it.
of Mike.
Oh, my gosh.
Oh, my.
Oh, come on.
There's her uterus. Ta-da! I really think it's urine. These are the horns of her uterus. This is called the vaginal vault right here. And very commonly when I'm spaying rabbits, you'll see urine refluxing up in the vaginal vault. So what I think has happened over time is that urine just kept refluxing up in there and getting stuck in there. Just a theory. This is only the second time I've seen this. She's gonna be so empty when I'm done with this. Although this is not a common condition, there are signs that owners can look for. The 2 big ones are that if an adult female bunny suddenly gains a lot of weight, or if her belly feels like a water balloon.
Wow, that is spectacular right there.
Ta-da! Lucy came in looking like a little watermelon. She's gonna go home looking like a little cucumber. I don't think the owner's even gonna believe this transformation.
Spay complete. 2 more procedures to go. Dr. K turns her attention to removing the large bump on Lucy's chin.
It's almost hard to sew her up because she's so flat.
Bubbles, a 5-year-old guinea pig, unexpectedly may be expecting.
We're bringing in our guinea pig, Bubbles. She's 5 years old. We got her a male companion, and we thought that she couldn't get pregnant, but we're afraid that that information was incorrect and that she is indeed pregnant.
We're worried. Seeing the doctor is definitely gonna clear things up, because we don't know if she's pregnant. She could be just chubby. Are you pregnant?
The problem with guinea pigs is that after the age of 18 months, their pelvic canal narrows significantly, making it impossible for them to give birth. Therefore, pregnancy at this point would be a life-threatening situation. Hi, guys. Hi. So we have our little tiny Bubbles guinea piggy, which is the maybe cutest name ever for a guinea pig.
Looks like a bubble. She's tubby and circular.
Oh my goodness,
Yeah.
she's so cute. So tell me how she could have possibly gotten pregnant.
We thought that she couldn't because she was so old. So we got her a male.
So they put the male and the female together, and the male's not neutered.
Yes,
Right.
that's correct.
Okay.
If she's pregnant, then we'll talk to you about what we need to do. If she's not pregnant, then we probably need to bring him in and get him
Neutered.
neutered.
Yeah, definitely.
Yeah. Come here. Good night to you. Bubbles, I love that name. What's her friend's name?
Mr.
Peanut Butter.
That's
Yeah.
cute too. Oh, she's absolutely precious.
We felt that, you know, as she's getting older, she should at least know that she's not alone in this world. So we got her a friend, and she's happy, she's purring a lot, she's just in love.
Hi, Bubbles. You're 5 years old and you just now got a boyfriend? Oh my goodness. You're like a spinster. You don't even know what to do with yourself now. Do they get along?
Oh, yeah,
God. Her
definitely.
personality has really bloomed.
Isn't that wonderful? They're so social. I always recommend people should always have more than one.
They're definitely spoiled. Spoiled guinea pigs get lots of fresh food.
We sing to them. Yeah. They like music.
Yeah.
This one likes Kanye, it turns out.
Oh, she's so cute. She's so soft.
Yeah.
What did that boy do to you, huh? I'm not feeling anything that I feel like feels like an enlarged uterus or feels like a baby. This right here. There is something large that's right here. I feel like they're on the side too. There is something large that's right here.
Bubbles has a tummy bulge that might be a baby, which is bad news for this aging guinea pig.
What did that boy do to you, huh? These guys can't give birth even if she wanted to at this point. It might be an ovarian cyst, which they commonly get. Ooh. I know, Bubbles, I know. Let me see. But it may be something else. I know, Bubbles, you're being a good girl. I am feeling a round, soft structure that we should just double, triple check. We'll just check it out. We'll just check it out. I'm gonna take some x-rays, and if that doesn't show me anything, we're gonna do an ultrasound just to look for a heartbeat. I'll know real quick if it's a cyst, it's gonna be full of fluid. If it's a baby, it's gonna have a heartbeat. I'm gonna take her. I'm gonna need her probably for those like 20, 30 minutes. Okay, thanks guys. I'll see you soon.
Bye, Bubbles.
She says, bye guys.
We're optimistic that she's not pregnant and that we've missed the bullet and that we can get our male guinea pig neutered so that Bubbles will be safe.
We're on part 2.
1 of 3, yeah.
Lucy, the rescued Easter Bunny, is spayed and now ready to have the mass on her chin removed, an infected tooth pulled.
All right, so she's got a mass, looks like just an abscess on the side of her face here. This is just the abscess capsule that I'm cutting off here. So what I'm worried about is that this capsule is deeply attached to the jawbone here. Yeah.
It's deep.
Yes, it is.
Huh.
Huh. That's what I said. Huh. Yeah, so it is attaching to her jaw.
This needs to be addressed. It's an infection in the jawbone. If this infection proceeds further, this is literally going to rot through her jawbone and it will break on its own.
Let me at least close it and then we'll get the tooth out and we'll figure out what to do out there.
This abscess looks a lot worse than I thought it was going to be.
All right, let's take her out there now.
Now I need to take her to her dental station in treatment so that I can take care of this lump on her jaw and pull the tooth.
All right, let's see. I got a very difficult job here.
There's a lot of things going on in that little tiny mouth, huh?
Yep. So that's definitely the tooth associated with the abscess then.
What has happened with Lucy is that she got a tooth root abscess that started in the mouth, and it was such a bad infection that it ate through and made a big pocket of pus that the owner noticed as a lump on her jaw.
Mercy. There we go. Okay.
By removing the tooth that was so badly infected, we essentially saved Lucy's life.
All done? Yes. Wakey, wakey? Yes. Okay, and call that owner.
Lucy's rotten tooth is out. I know her owner is super anxious to get her back home with him, but this has been a long, rough day for her. We need to just have her rest in the hospital for at least 24 hours before I go ahead and send her home.
We're gonna love on you all day, don't worry. I know.
Can you walk him out to go potty?
Does he walk?
Yeah.
Leash.
While Dr. K waits for Dexter's urine test results, the precious goat will get a supervised potty break.
Hey, handsome, you wanna get out?
Alex, you wanna come take Dexter for a walk with me?
Yes,
Come on, Dexter,
I love
let's go.
him.
Let's go, boy. Let's go. Little tail waggle. This way.
Come on, you bow tie little
boy.
king. He is taking off.
Oop. I think he's going home.
No.
He lives in the house with us, so he's a little bit extraordinary that way, so he's our little kid.
Oh, he's peeing.
Oh, there he goes. Okay, good. There, he did have to
Good
pee.
boy. Well, he really had to go.
Where are you going? Where you going, crazy pants? Go this way. You can't go out in the road. Oh, he's so cute.
Because he can't fend for himself, we have to keep an absolute eye on him all the time. He's not terribly intelligent, so he'll get stuck in corners, and he just waits till somebody comes to get him.
All right, we're going. We're going inside. All right.
Did you do a big BB? Come here, Dexter. Was there any blood in the urine?
It didn't look like it was hard to tell. I wasn't really like studying it.
Look at that sweet little baby.
And he wasn't straining or anything.
Diane didn't see any blood in Dexter's urine, so that's a good thing. But when the owners reported to me is when they're seeing the blood is after he's voided his whole bladder, and they'll see drips of blood around the house. So we're gonna let Dexter walk around the clinic and see if I can see what the owners have been describing to me.
Oh, now there's a little bit of blood, Dr. K. He peed a
Oh, the
little
rest
bit
is
more.
a
There's a
little
little bit of blood.
Oh.
Oh, now there's a little bit of blood, Dr. K. He peed a little bit more and there's a little bit of blood.
Oh, the rest is a little bit? Oh. I see. That's what the owner was describing, that after he voids, that's when he has some little...
Oh, interesting, okay.
He's been dripping blood on the floor. Confirms absolutely no doubt that's what the owner was seeing. Now I need to look under the microscope at this urine to see what else I'm seeing in there.
You're such a good goat.
There's just too much stuff.
And he's just got tons and tons of this sediment in the urine, and that's secondary to his diet. It does look like there's a lot of bacteria in the urine. I do see bacteria, so I know there's a urinary tract infection here. Since he's been having blood in the urine, was blocked, and is probably uncomfortable, I'm gonna treat him aggressively with some antibiotics to get started.
Hello, my lovey boy. Who's the best goat? Who's the best goat ever? That's you, Dexter. Oh, you're a good boy. Here's a shot. I know, honey. Oh, you're the good goatie. Oh, it's ouchie, done. It's undone. It's all done.
Because Dexter is a special needs goat, he has a special diet. He should be eating a lot of hay, but Dexter doesn't eat hay. He eats a special slurry diet. He needs this diet to keep him alive, but this particular diet is what's most likely causing the crystals in his urine.
So he's 3 years old, and he's made it this far in life, just not eating on his own, just the gruel, but that's gonna continue to make all this junk in his urine.
Yeah.
But there's no way around it. He can't eat otherwise.
You could try the rehydrated hay, like hay cubes that you soak
Yeah.
in water, and they're really, really mushy.
And they come in cubes. And it's like a powder packed into a cube?
Yep, and it helps get fluids into them, but it also is not like firm hay, like it's...
All right, I'll write it in his discharges.
Dr. Stoneberg told me about a product I've actually never heard of called Hydrated Hay that the owners can get at the feed store. He can actually get some more fiber in his system. So I've never actually prescribed Hydrated Hay before, but it's all about helping little Dexter. So I'm 100% for this, and I can't wait to see how it works out. Hydration Hay.
Yep.
Lucy, the rescued Easter Bunny, receives constant care, following an intense day of surgery.
So I'm here feeding her right now. She's not eating so much on her own. She hasn't pooped. So we're just gonna feed her, give her some fluids. We just wanna make sure that she is eating on her own, she's pooping on her own, and just overall doing well so that she can be able to go home. Okay.
And up you go.
You're all done, pretty girl.
Oh, he is gonna fly around everywhere. Oh, Aaron, watch out. Oh, Murray. Bye.
She's really cute. This guinea pig needs a lateral x-ray, and I'm probably gonna ultrasound it. I think it just has ovarian cysts, but it may be pregnant too. Bubbles isn't today because her owners think she's pregnant. I definitely felt something in her abdomen that was a little suspicious, and that's actually what the owners were feeling too, and that's why they brought her in.
Come on, Miss Bubbles. It's a pretty chubby pig. That's why we came here. We're not positive. It's hard to tell if she's pregnant.
You're gonna be a really good piggy. Oh, you're very cute.
This is really important that we figure out if they're sister babies because guinea pigs, if they haven't had birth before the age of 18 months, they can't. So the pelvis is really wide when they're young, and then it will narrow down after they're about a year old. So it's physically impossible for her to give birth. She will die. So that's why this is not just something like, oh, we can just wait and see, maybe she has it, maybe she doesn't. Like, no, this is actually a life-threatening situation. So we have to rule out that she's pregnant.
Did you move? Hmm?
She's definitely one of the family. So we wanted to bring her here. We didn't want her to have any kind of pain or anything.
So we'll have the doctor look and see if you got babies.
I'm taking a look at my quick little guinea pig x-ray. I just set her on the plate just to look for any kind of babies. Which I don't see. So I'll just do a quick ultrasound, just confirm that the bulges I'm feeling are probably more like ovarian cysts versus babies. Can I get a technician to hold my Bubbles friend while I ultrasound? So this is what I was feeling that was suspect. That. So this is what I was feeling that was suspect. I think it's an ovarian cyst. Make sure it doesn't have a heartbeat.
I don't see a heartbeat. I don't see a heartbeat either.
Okay. No babies, good job. You're lucky. On ultrasound, I took a look and no babies, no heartbeats. So thankfully, Bubbles got really lucky and didn't get pregnant this go around. That's a cyst. It's got to be. So it's good news that there's no babies, but she does have an ovarian cyst, which ovarian cysts are pretty common in guinea pigs. About 80% of them have it, and it's just due to hormonal influence on the ovaries and not necessarily due to some kind of cancer. So given the fact that Bubbles is 5 years old, I don't want to recommend anything too invasive. Guinea pigs really only live 5 to 7 years, so putting it through a surgery is just asking to uncover undiagnosed diseases and have potential complications. I'm gonna let the owners know that thankfully we dodged a bullet here. Bubbles is not expecting. However, we need to separate them immediately. And oh, by the way, we probably should neuter the male at this point.
Push, 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 push. There you go. All right.
Oh, yeah.
Oh, yeah. As an exotic vet, our patients come in all kinds of shapes and sizes. I've got my huge tortoises, I've got my big pigs, I've got some goats that are pretty big coming in here. Sometimes we even get some large cats that are hundreds of pounds. So it's important that we stay in shape.
Yes.
Gotta be in shape to work on these animals.
Oh my goodness. Ugh. You, buddy. Why are you so big?
Dexter, the 3-year-old goat, is ready to head home. And his owner is ready to get him back.
All right, I have a one precious baby goat coming right up.
There he is.
Dr. K just wanted me to go over the discharges with you. She gave him an injection of an antibiotic that's long-lasting.
Okay.
The last thing she recommended was these hydration hay blocks that you get from the feed store,
Okay.
just because that will give him the hay that he needs, but also hydrate him.
My little buddy Dexter will be feeling better soon. He's a great little goat. I hope to see him again in the future, but not with a medical problem.
He's very precious. We all were loving on him today.
Thank you.
I love his little bow.
You know, hopefully this was a one-time thing and it doesn't come back.
You guys take care.
Thank you.
Bye, Dexter.
Hi, dog. Oh. He'll be very happy to go home and get into bed and have dinner. He missed lunch. I'm surprised he's this well-behaved. Thank you. I can't love him anymore. He's addictive.
Bubbles' owners are about to find out if their guinea pig's tummy bulge is a baby or not.
Alrighty, we don't have any babies.
Oh, yay.
We do have ovarian cysts, though. They're about the size of a grape tomato. So as long as they stay...
Pretty big.
It is pretty big. That's why I thought they could be babies. They're so big. But as long as they stay that size and they don't cause her any problems, she's eating, she's thriving, she's fine, they could be okay for now, considering her age. Now, if I would have diagnosed that in a 1-year-old guinea pig, I would have said we probably just should spay her. But at this point, she's already improving her life, right? She has a new friend, and I think she's probably gonna be okay.
Okay, great. So, but she could still get pregnant.
Oh, yes.
So we need to neuter her.
Yeah, we need to do the guinea pig. Absolutely.
She is not pregnant, thankfully, because that would have been horrible for her age.
Yeah, and we are going to neuter our male.
Yes,
So we
definitely.
won't have this problem. But in the meantime, they have to stay separated, which they're not going to like.
That's awesome that they got along so well, though. Like, just immediately. That's
When
doesn't
you
always
separate
happen.
them, it's like Romeo and Juliet. You
I know.
He's out there and the bubbles, bubbles, where that worked out.
That's so cute.
We're relieved.
If she was pregnant, that could have been fatal for her.
And then we'll get your boyfriend neutered. She'll have a friend again, okay? All right,
Okay.
guys. I'll see you later.
Hi.
Bye.
Everyone at home will be relieved that she's not pregnant.
Especially my spouse, who was not thrilled that we got the other guinea pig in the first place and was mad that this one might be pregnant. Thanks, guys.
Lucy's owner returns, anxious to take his bunny home.
I'm anxious to see her. The past 2 days, waking up and not feeding her, not hearing her make her little noises, you know, looking to see what's happening in the house, it was weird. It's just, they become a part of the family, and you really like having them there.
Lucy's little miracle bunny. She's tough. She pulled through 3 major procedures. She's spayed. I took the tooth out. I was able to get the abscess out. She's eating on her own like a champ, and that's a great sign for a post-op patient. I think Josh is going to be shocked when he sees how slimmed down his little bunny is.
All right.
Oh my goodness, she's so much smaller.
Right? I know, right?
That is a different bunny.
Pretty sure this one's yours.
That one's mine.
She's all kinds of skinny, but she
Yeah.
feels so good.
She has to. All that pressure on her, she looks like a little baby bunny again. All the fluid built up on her made her look like she was overweight, but she wasn't. And now she's all tiny.
Now you like it.
She's been through a lot in the past 2 days. It's amazing what all that little body went through.
Go ahead, sweetheart.
I'm just glad she's no longer in pain and she'll get back to normal.
Hi, Lucy.
I'm feeling really good about sending Josh home with his new downsized bunny. He's a great bunny father, and this is going to be a great outcome for Lucy.